What is cervical cancer SCC? Imagine a tiny change in the cells of your cervix that could grow into something more serious over time. That's what happens with cervical cancer, specifically the most common type called squamous cell carcinoma. This cancer starts in the flat, thin cells that cover the outer part of the cervix, known as the ectocervix. These cells are like the skin on the surface of your cervix and are called squamous cells. Most cervical cancers are squamous cell carcinomas, making up about 70 to 90% of all cases. They usually begin in an area called the transformation zone, where the outer squamous cells meet the inner glandular cells of the cervical canal. This zone is important because it's where cells are constantly changing and renewing, which makes it more vulnerable to abnormal changes. The main cause of squamous cell carcinoma of the cervix is persistent infection with high-risk types of human papillomavirus, or HPV. This virus can cause changes in the cells that, if not caught early, may develop into cancer over several years. That's why regular screening tests like Pap smears and HPV tests are so important. They can detect precancerous changes before they turn into invasive cancer. Within squamous cell carcinomas, there are subtypes based on how the cancer cells look. Some produce keratin, a protein that makes the cells tougher, and these are called keratinizing squamous cell carcinomas. Others do not produce keratin and are called non-keratinizing. Rare variants include verrucous carcinoma and papillary squamous cell carcinoma, which are less common but still part of this group. Understanding that most cervical cancers are squamous cell carcinomas helps doctors decide on the best treatment options. These treatments can include surgery, radiation therapy, or chemotherapy, depending on how advanced the cancer is. Prevention is also key. Getting vaccinated against HPV and attending regular screenings can significantly reduce the risk of developing this type of cervical cancer. Because cervical squamous cell carcinoma develops from the cells on the surface of the cervix, it's largely preventable and treatable when caught early. If you have concerns or notice symptoms like abnormal bleeding or unusual discharge, it's important to see a healthcare professional for evaluation. Remember, each person's situation is unique, so personalized medical advice is essential. Always consult your doctor for guidance tailored to your health needs.